All right, welcome back. I'm Dr. Steven Ramos, Associate Medical Director with HealthTexas Medical Group, and this is another Wellness Wednesday. We're bringing in important topics and information about your health to the general public, and today I have a guest with me, Dr. Joshua Urteaga. He's at our Highlands Clinic, one of our newer doctors. Welcome.
Thank you. Thank you for having me. Thanks for the invitation.
Yeah. Real quickly, Dr. Urteaga, give me a rundown of kind of who you are, how you got to San Antonio, and just a little background on you.
So I'm originally from San Angelo, Texas, born and raised. I ended up, going through my medical career in Guadalajara. Was in New York for about a year, but ultimately my roots were always in Texas, and San Antonio was always close to my heart and my wife's heart because of family. So we ultimately migrated, eventually here to San Antonio.
Fantastic. We're glad to have you.
Thank you.
Today, really important topic, falls prevention. Falls can definitely be something that can really hinder one of our patients' health, and it can cause a lot of problems. Really during the holidays, are falls kind of more of a problem for patients and people, or?
Well, that's actually a very good point. During the holidays, usually there's inclement weather. It gets a lot more cold, freezing, ice, some parts of Texas snow. And that can always increase, the risk of falls outdoors, but there's also significant risk indoors.
So what are some things, I guess, during this kind of holiday season that we can do to help prevent some falls?
There are some things that we can look at indoors. Is something that we can do is maybe go throughout the house. There's some decluttering that you can do in the hallways, the common areas. There's some things that you can apply maybe in the restroom with non-slip mats in the bathtub. Those are some of the instances where people have the higher incidence of slipping or falling. And just kind of take a look at those areas that are loose around the home, maybe some boxes, rugs, things that you can trip over. And the shoes that we wear have a significant, importance, right? Because if you use the slip-on shoes, the slippers, in the morning, those can get caught and you can fall very easily with those. Yeah,
and good thing about rugs and carpets and things around the house, and like you said, shoes. One thing that I've encountered with some of my patients where maybe they're having some kind of almost falls, or someone kind of reports, well, so-and-so fell the other week, he didn't want to tell you, but I'm letting you know. One thing I ask a lot of my patients about is, eyesight. Sometimes, rooms are not well lit, and you see a cord, or, maybe the eyes have been going for a while, they just didn't know, and now they're tripping over things. Is that something you've encountered?
Yeah, and that's actually an excellent point. Things that we always encourage is to have well-lit areas, to have night lights, especially tracking to the restrooms, the bedroom, things where you're most commonly to walk, at night, to prevent those types of unforeseen falls or tripping over things that you wouldn't normally trip over.
Yeah. So how about outdoors? Say it's the colder months, like you said, and we're venturing out, and I don't know how much we're going to be doing that with the pandemic, but right. If we do, what are some things we can do going outside that can keep us safe from falls?
So some of the things that you can look out for is fallen leaves, branches. There's some things like slippery places if there's ice, or any type of that debris that can be left over with these inclement weather, winds and things like that. So just look out for those.
Okay. So say you have a patient who's maybe fallen a couple times at home already. So right. What are some things that we can educate our patients about as far as their health, maybe, to help prevent some falls?
So that's an excellent question. And this is something that you can bring to your doctor and discuss about. If you're on certain medications, you should ask your doctor what medications can maybe increase my possibility of feeling dizzy or having that inclination of falling. Also some medical conditions. There's some medical conditions can give you an increased risk of falls. Say you change position, from lying to sitting to standing. You can have maybe a drop in your blood pressure. These are all great questions to bring to your doctor, along with the medications that you're taking, so they can have a complete and full history.
Yeah. I mean, important things to always kind of bring up with your primary care doctor when you go see them is if you have been maybe feeling, unsteady or unbalanced, or you had a fall or two, don't keep that to yourself.
Right.
Let us know so that we can kind of figure out what's going on, and we really want to make sure that a really significant fall doesn't happen. And just to be clear, I mean, what are some of the downsides of falls? Some people say, well, I fell in the shower or something happened, but I'm okay. I don't need to worry about it. I mean, should we worry about that? And what are the major issues that can happen after a fall?
So there's a certain age, especially people older than 50, that have an increased mortality and morbidity. And falls are the leading cause of disability in people 50 years or older. So you're kind of getting into that golden age of life, and you have this unforeseen fall. You God forbid you fracture something, and you're most likely to end up in a skilled nursing facility for rehab. You just have a whole brakes on your life and what you're expecting to enjoy because of something that possibly could have been prevented.
Yeah. I tell my patients, and you'll hear me say this kind of over and over again, but if I can keep my patients out of the hospital, I've done a good job, in my opinion. And a fall is just definitely something that can put a patient in the hospital. I mean, a fractured hip, a broken hip often requires surgery, long rehabilitation, disability, all those types of things. So if maybe you have a parent or a grandparent or a spouse that has fallen at home, and maybe they're a little bit of a pain, but you just don't really know, okay, what do we do next? So if that situation happens, what would you want to tell your patients?
Well, first thing is, bring it up with your doctor, let them know what's going on. Family is usually, like you said, the one bringing up, these types of instances. But discussing if there's some benefit of you having some medical device, maybe a quad cane or some type of assistant device for you to walk, just to make sure to give you that stability at home. Also is very important, like you kind of led to in the beginning, a vision examination. Is there something wrong with the vision? We need to be proactive instead of retroactive. We have to take initiative to prevent these instead of kind of reacting towards after.
Mm-hmm. Yeah, excellent stuff. How about exercises? Vitamin D supplementation, bone health. What do you think about all those types of things?
So that's a good point too, because I always encourage my patients in my practice to have some type of routine in the morning, some type of range of motion exercises, strength exercises, not really to have cardiovascular prevention, but more of toning your muscles, keeping them well toned, stretching, making sure that your balance is well. And in those instances, you can sometimes tell, okay, maybe something's off, or maybe, you feel real good, and you'll take on your day a lot better.
Yeah, I think strength is something, muscle mass, the stronger muscles we have, the stronger our bones are going to be, the less likely we're going to actually fall. And if, God forbid, a fall does happen, slip on some ice or a loose cord, if our bones are a lot stronger, everything's healthier, the chances of fracture, major injury, stuff like that is much, much lower. So like you said, preventative is really the way to go. We don't want to be catching up after the fact. Let's try to prevent problems before they come about.
Yeah.
Okay. Well, do you have any good resources for our patients out there if they want to, read more about fall prevention or what they can do to help prevent falls?
I always recommend this website. It's called familydoctor.org, familydoctor.org. It's a good general resource. You can look up not only for falls, but other type of medical conditions, and it's directed towards patients. So it'll give you accurate things to bring up with your doctor, and it's not just Googling, so it's a lot better.
Great. Well, we appreciate all the information. Thanks for joining us here on Wellness Wednesday. And just remember, currently right now, it's Medicare's annual open enrollment all the way through December 7th. So if you have any information or you want any information about Medicare enrollment or Medicare plans, please just give us a call on the number below or visit any one of our 17 locations. Y'all have a wonderful day.